Good morning, Amy. Happy Friday.
Good morning. Thank you. Thank you for all, for Blair, for April. Thank you for putting this on so quickly.
Yeah.
Yeah,
So
thank you
I
guys
think,
too.
yeah, thank you guys so much. I think that we're getting people into the chat right now as we speak. Looks like we are up to almost 150 participants. So thank you to our viewers for getting this information and reacting so quickly. Public health has been moving at a very quick pace, and thought that it would be really important to get out in front of the business community in advance of this level orange updated public health order going live. So we do have Amy and her team here again with us today. As many of you know, a lot of things have changed since we met with these folks last week. And again, we just wanted to provide an update and make sure that you have as much information as we can possibly give you. So again, many, many thanks to our public health team for their willingness to speak with us so directly. See, I'm getting a thing that it's pretty quiet in my chat. Try to turn my volume up a little bit. But yes, so we will have a little bit of time for Q&A at the end of this. We anticipate a little bit of time for Q&A. So if you want to put your questions into the chat, we will get to those as we can, as time allows. And without further ado, as we talk about time, I will go ahead and turn it over to Amy and her team to get us updated, and we can go from there.
Thank you so much, Blair and April, and thank you for all of you who were able to attend on such short notice. It was a fast-moving train, as Blair mentioned, and has been for the last several weeks as our cases continue to skyrocket in an exponential way. I just wanted to share our latest data that was updated yesterday afternoon. We are at 806.9 cases per 100,000 and 14.9% for our positivity rate. So that's the rate of positive test results compared to the total tests that we are doing. So this is a dire situation. We've been talking about this over the last several weeks, that we may be moved to a more restrictive phase if we continued on the path that we were on, which unfortunately is where we are today. We did have our consultation with the State Health Department late Wednesday afternoon, and they required us to move to the more restrictive level of orange. And we are required now to follow all of the restrictions on capacity limits that fall under that level orange. And then we were also strongly encouraged to implement any other strategies that we felt were more restrictive to really target where we are seeing cases rise. And that continues to be in personal and social gatherings. And so, we also are implementing the recommendation for stay at home for everybody from 10 to 5 and prohibiting gatherings in that time frame as well. I know most of you are joining us today to really talk more about the restrictions and the capacity limits, but I also want everyone to be aware that, really across the whole state, we're seeing more and more cases. We are not unique in this. We were moved to level orange with several other counties across the state, and who are also putting in these more restrictive capacity limits. Unfortunately, this is not where we wanted to be. This is not where you wanted to be. But we continue to see our cases rise. And yes, we haven't seen a huge influx in our local hospital, but across the state, if we continue on this path, we will be reaching our ICU capacity in the next couple of weeks across the state. And so we are and know that hospitals are a late data metric that we see after we have wide community spread of this virus. And so we're really kind of worried about seeing that and starting to see that here in the county. We started off seeing most of our cases happen within the age group of 20 to 29-year-olds. That was about a month ago. And since then, we continue to see increases in all of our age groups, actually. And so this is just something that we needed to do. We were required to do by the State Health Department. And so we're happy that you're joining us so that we can talk through some of the specifics, answer your questions. Hannah Wind is here with me. She's been kind of our expert lead in the EOC and answering COVID questions around our public health orders. So she's going to be talking to you about what the restrictions are. And again, really sorry to be talking to you under such circumstances when we know we have these easy, cheap, very effective ways of preventing this virus, including mask wearing, hand washing, physical distancing, avoiding gatherings, are very effective at suppressing the spread of this virus. We do have now 3 community testing sites up and running, so we're hoping that we can do the best job that we can to identify everyone in our community who has this virus, including anybody who's asymptomatic, because we know that people can be asymptomatic and carrying this virus, especially if you've had a known exposure and aren't getting symptoms, you can absolutely still transmit this virus. So we have a new testing site that came up that started today on the north end of the county at Silverthorne Recreation Overflow parking lot. So thank you for the town of Silverthorne for offering this new site. This is a site that will be up for at least 2 weeks, maybe longer. And that is a drive-through site. People can come through. We've heard that it's already been extremely busy since it opened this morning at 9. This site will be open every day from 9 to 6. It increases our capacity actually by 600 tests a day. We thought it was only going to be 350 tests a day, but we absolutely can test everybody in our community who needs to be tested or wants to be tested. We also have the Vale Health site that came up and is up and running since yesterday, and they are on 3rd and Granite in Frisco. And then we have, of course, our Centura site, who's been an amazing partner, but really limited in their capacity given the demand we have and the widespread transmission happening in our community. They're continuing to do testing as well. The Vale Health site is open Monday through Friday, 8 to 5, and then Centura is open 8 to 4 Monday through Friday, and then they have limited time on the weekends. All of the testing information is available on our website. And so you can go there for how to access these 3 testing sites. And then we have additional testing capability happening at our schools starting this week for school staff and students. And then our community care clinic, of course, continues to do testing for their patient population. So I'll turn it over to Hannah, and she can talk about the main restrictions that we're talking about under level orange. And then, of course, we'll open it up for questions if you have any. Thanks.
Awesome. Thank you, Amy, Blair, April, Nicole, everyone for getting us together. We know everyone is anxious to get this information, and we're here to help try to address those questions before that order goes into effect at 5 p.m. this evening. So I will just pull up real quick. Let's see if I can share my screen. All right, so hopefully everybody can see that. These are kind of just basic guidelines that the flyer from the states put out for level orange, the current level we're in. So you can see lots of different sectors on here. In general, all of this applies to us where there's discrepancies. There's with indoor and outdoor events. Indoor events, our local public health order is capped at 25% capacity, but 25 people. Otherwise, most of this is going to be applicable within our county. So some of this may be useful to different businesses to see, just kind of an overall what we're looking at here. And then otherwise, in general, in our public health order that's local to Summit County that came out this morning. So there was a press release that went out with that. And it's also posted on our website as well. Some new additions to that is public and private gatherings are now prohibited between 10 p.m. and 5 a.m. And so those are those gatherings that we've talked about before that, you know, you'll be hosting people at your house or things of that nature that, you know, we're trying to limit that spread of the virus within environments such as that. And then in addition to restaurants, you know, we have seen those outbreaks occurring among staff members at restaurants as well. When more alcohol is included later in the night. So there is now reduced hours of operation for restaurant and bars that goes along with the curfew requirement. So in that local public health order, bars and restaurants now should be closed by 9:30 p.m. And so anybody that's dining at that restaurant should be gone by then. And then the goal is to also have staff members to give them plenty of time to be able to return home before that 10 p.m. Curfew as well. And then in regards to some of the questions we've been getting, there's been a lot of questions in regards to with businesses going down to 25%. How do we calculate that? In general, with most businesses, especially with retail, you're wanting to look at your fire code capacity. So, that's either posted above your door. You can reach out to the fire department or the building department to help get more information on that. We're working with the building department to be able to push out some more information so people are able to easily know that information. And then it'll be 25% of that capacity for your business space. And I know, April, there were some questions that had come through on your end for things to address. Would you be comfortable with reading some of those off and I can address those?
I'm sure. Are you talking from our recovery group last night?
Yes.
Yeah, I'll need just a minute to find those. So if we want to maybe start with a couple from the chat that I see, and then I can move ahead.
Okay.
I guess one offhand would be relative to the restaurant community. How does the curfew work? Do they need to get their employees home by that curfew time, or are their employees able to stay after that time? I mean, so they can get everything cleaned up and then be on their way home at the curfew time, or must
And
they?
and I'll just add to that, Hannah. Just with restaurants going down to the 25% capacity under this new order, if that extra 30 minutes does make a difference for them. And it was brought up that perhaps there were exceptions to that for restaurant employees down in Denver, and if that would be possible here in Summit.
I can answer that one, Hannah. Right now, we're not making any exceptions, and it's not a curfew. I think we just need to make sure we're using the correct language. We had talked about utilizing a curfew. Now we're strongly suggesting people stay at home between 10 and 5, and that restaurants close at 3. Or 9:30. We understand that cleaning needs to occur, and that absolutely should allow for that time. And then as soon as that is done, people do need to be leaving and getting home.
Thank you for that clarification, Amy. I think that that's really helpful. It's not a curfew. It's just we are encouraging people to be home from the hours of 10 p.m. to, I think it was 5 a.m. Is that correct?
Correct.
Great. How about this? Can you kind of outline what is the difference between the May 1st rules and the rules today?
There's been a lot of rules, so I can't speak specifically to May 1st exactly. I'm guessing that person may be inquiring about kind of when we were in stay at home and possibly what that was. So, for example, with stay at home, we didn't have restaurants open. We had curbside only, similar with retail restaurants as well, or with retail stores. And so this is not stay at home yet. That would be the level past this. That would be level red. And so we're kind of in a in-between level right now with this level orange, to where, we're doing the best we can to keep our economy open and have things open without reaching that stay-at-home level where things are having to be closed for in-person services. I don't know if you'd like to add anything to that, Amy.
No, I think that was a good explanation. Thanks.
So looking at the Colorado COVID dial that you put up to begin, Amy, it's clear that we're in the stay at home in at least one of those 3 categories, and very close to stay at home for a second one. What is the likelihood that we do get moved into that stay at home? And I guess maybe how critical highlighting again how critical it is that we really do commit to these 6 commitments to containment, so that we do not get pushed back into that stay at home level.
Thanks, Blair. That's a really good question, and one, the governor really does not want to get to a place of stay at home. That's why we were encouraged to put in even stricter mitigation strategies and not we weren't forced to go to stay at home, even though our numbers right now and case numbers have been in that stay at home place on the dial. So right now we'll have weekly, visits with CDPHE to see and check to see if our mitigation strategies are working. What's also important to know is that if we do start to continue to see, or if we do continue to have an increase, yes, it's possible we might be forced to move to that stay at home. But again, we're really hoping that that is not going to be the situation. The governor does not want to do that. None of us want to do that. That is not where we want to be. We know that that comes with, as this probably will as well, so many unintended consequences for our community, our economy, our behavioral health, our workforce, it goes on, and we know that that is really tough for everybody in our community. We are bound to these metrics and to what the state health department is requiring us to do. And that I know is a really unfortunate place to be in. We do feel that some of the mitigation strategies we have in our public health order will make a difference as long as people comply with them. Our results, our tests, our cases are directly related to 80% of personal behavior happening within our community. And it's up to each and every one of us to make decisions personally on our personal time at work, to be able to get our numbers back to where they need to be for a successful and safe ski season, for our businesses to continue to operate and be open, and for people to have jobs. And so, it's going to take every one of us to step up and keep each other accountable, both at work and outside of work. Myself, I continue to get invited over, to places for dinner, and I'm saying, no, you can't, I'm not going to be over there. That's not what our public health order is recommending or requiring for us to do right now as a community. So I do think it's up to each and every one of us to continue this. I think it's really important for your staff and your employees to understand where we are in this information. I don't think we're able to reach everybody, or some people don't believe that this is a serious, or that the illness is very serious. And so they don't want to comply with what we're asking people to do, but it's very easy, it's very safe, and it will keep our businesses open. Our season will happen as long as people do these very simple things. Because again, we're bound to these metrics, and we will be continued to be forced into more restrictive situations if we are not able to turn things around. So it's really up to our community. And we did such a great job with this in the summer. We know in the winter, it's cold, people are going to be going inside more. We know transmission can happen more readily in an enclosed space. So even if you're going over to somebody's house, you should be wearing your mask. Don't assume that there's good ventilation there. Don't assume that they don't have symptoms or haven't been exposed to somebody. You are more likely to get this from somebody you know than somebody you don't know. And until we all are masking up and keeping our distance from people, even people that we are close to and trust, we are not going to turn this around. And so I can't stress that enough. We're putting in things that we feel can make a difference, but we need our communities to step up and to follow what's recommended.
Thanks so much, Amy. And I guess I would just, it looks like we've got a lot of questions coming in the chat. Many of them are just clarifications on the new orders and making sure that people are adhering to these, but they need a little bit more guidance on those. So many of those are also similar to what our economic recovery group was talking about yesterday at our meeting. So I think at this point, maybe we'll have Blair kind of run through some of those so we can get these questions answered for people.
Yes, absolutely. Thank you, April. Let's just jump in right now. Who should people contact if, say, for example, your neighbors are having a party and it gets to be after 10 o'clock?
Yeah, that's a great question. So they can contact our public health order violation phone line, and I had just put that in the chat. They're available 24/7. It's our non-emergency dispatch line, and the phone number for that is 970-668-8600.
And I would just like to add that, it's not just after 10 o'clock that we want people to call this number. If they're noticing even at 6 o'clock that their neighbor is having lots of people over, or it's a short-term rental that has more than 10 people. Remember, our gathering size is 6 indoors with only 2 households present, and outdoors only 10 people or less, and still only 2 households present. So it's really critical to understand those gathering size restrictions.
Thank you. Do grocery stores such as City Market have the same restrictions of 25% capacity?
So they do not fall under the 25% capacity because they are listed as a critical retail business, but they do have their own capacity limits and guidelines that they fall under.
And related to that, with retail businesses that maybe don't fall under that critical category, for the 25%, does that include their employees that would need to be out on that retail floor?
So in terms of retail, yes. For example, restaurants, no, their staff is excluded in terms of restaurants.
This slide, one of the slides says that bars are closed. Is that just for entities that don't serve food, or does that include bars that also serve food?
So for a bar that serves food, then yes, that's permitted to be open. But as soon as that food service stops, then no, that place should not be open any longer.
Great. Does the 25% occupancy include outdoor patio dining or just indoor?
Only applies to indoor per room in that restaurant. So outdoor is still the same requirements of just maintaining that 6 feet of distancing between tables. And then in addition, making sure that those parties seated at those tables do not exceed the group size limit of the 6 people, no more than 2 households.
Great. This one is specific to physical therapy. Will they see any changes under this new order, and specifically PT that's operated out of the Breckenridge Recreation Center?
So they can follow up with our email. I can put this in here real quick. It's our COVID questions email inbox for people that have specific questions like that. To my knowledge, PT falls under limited healthcare services, which is limited right now, I'm pretty sure, to 25% capacity or up to 25 people, whichever's less in that case. But shoot us an email and I can help you with that specific question, just because some of those personal services, limited healthcare, get a little sticky.
Thanks, Anna.
Yeah.
I think this is a pressing question for many people on the call. What does this mean for ski season? Is there concern about people coming in from out of town and out of state to ski in Summit County?
So this is a great question. And I think what's important for everyone to understand is right now, we have wide community spread of this virus here in our county. People coming here aren't gonna probably impact much of that. The ski season itself, all the ski resorts have been approved for their operational winter plan, and they all have to comply with the 25% restrictions in all of their indoor spaces on the mountain. Their restaurants, their retail, their rentals, everything else they have to also comply with. They also have to decrease their capacities based on that, because less people will be able to utilize those amenities. And so skiing itself is not a high risk activity. It's not unlike going hiking on a trail, etc. But they are held to all of the same restrictions and capacity limits that you all are with those amenities that they have.
Great. This goes back to restaurants and capacity. Please confirm that restaurants need to be at 25% capacity or 50 people, whichever is less.
Yes.
That's correct. I mean, perfect. Thank
Correct.
you, Hannah.
Whichever is less in that situation. So even if you do have a massive capacity, say for example, some of our ski resort lodges that have huge dining areas, they might be able to potentially exceed that 25%, but the max is still 50. So whichever's less in that case, you are correct.
And then just not by 9:30, there should not be any more dining customers, correct?
Correct.
Great. All right, let's see here. I was just wondering how we impact the positivity rate without numerous healthy people going to get tests just to be negative. It is a bit confusing to understand how to impact that number. Sorry if this seems overly negative.
No, I think that that's a really good point, especially when we know about asymptomatic spread and that we do have silent spreaders that occur in our community. And certainly now that we're seeing such widespread community transmission, the only way to really know that we're reaching everybody who's positive is to have as many people get tested as possible. And so, yes, it might seem that that's a wacky way to work on the numbers, but until we get that positivity rate to 5% and ensuring that we're providing enough testing that as we need for the demand, that's the only way to show that we're actually capturing in the transmission of the virus, identifying those people right away who need to be isolated and their close contacts who need to be quarantined. That is really the only way that we have to identify how widespread this transmission is happening. And so it's a great question, and it's a little bit complicated. And yes, we're also likely to add more cases to our case count if we're also offering more testing. But this is one of the best tools that we have to really identify as quickly as possible those that need to be isolated and or quarantined, and that will help stop the spread of the virus. But people also need to comply with the guidance and the recommendations for doing so, as well as participate in our interviewing that has to happen with our team. That's so critical to identify those close contacts who also need to remove themselves from being out in our community so that they don't continue to spread the virus as has been happening.
Thanks, Amy. And kind of along those same lines, you mentioned, having enough tests. Is it recommended that more of us test regardless of symptoms?
So I think that that's a really good question. Again, one that we get, and it's really important for everyone to have this information. And certainly those who know that they've been exposed or who have symptoms, absolutely, 100%, we want everyone to be tested. But if you're getting a test today and you don't know that you've had an exposure, you're not having symptoms, it's possible you might be positive, and it's more likely still that you'll be negative. What's important to know about that negative test is that it only tells you in that moment in time that you're negative. So it's not a get out of jail free card to go have a party that night or host friends over for dinner, or say I can do whatever I want for the weekend because I'm negative. You might be positive the very next day. So I think it's really important for everybody to understand that this is not a test, a one-day test if you're not symptomatic and it's negative, that you are free to go about and not follow what we know works, which is continuing to wear your mask, physical distancing, avoiding gatherings, etc.
Great, thank you. As a small business owner, contingency planning is helpful. That said, if we were moved to stay at home, how long would that last? Is it a certain number of weeks, or would it be until the metrics were back in the safer at home level?
That's another great question. So we will not be able to move to a less restrictive phase, and this is dependent on whatever phase we're in. We are not allowed to move to a less restrictive phase until we meet the metrics for that phase for 2 weeks straight. And so we are in where we are right now for quite a while, because as you know and have seen, that our numbers are actually in the stay-at-home level. So we're going to have to do a lot of work as a community to get back into that meeting the metrics for the level yellow, which is where we just came from, to have the, all of the amenities that we were hoping and being able to use in the last several months. We want to get back to there, and we can as a community if we all step up and do what we need to do on a personal level.
Great. How will the restrictions be enforced? If 80% of the transmissions are happening socially, it is obvious that the community is complacent and won't make personal changes unless there is enforcement.
So I want to correct that. Not 80%. 80% of our cases are not socially. 80% of our cases are due to personal choices. And so those personal choices are happening at work. They're happening outside the community. They're happening within our own households. So making sure that we're all following those commitments are really critical. Following the order, not getting together with friends and family, and maintaining the gathering sizes to be really really small. So enforcement, we do have great relationships with our sheriff as well as law enforcement in our communities. We are absolutely, promoting our 8600 number for people to call and complain about possible violations of our public health order. We are, as public health professionals, can't be out and about in the community, so we're really relying on our community to also step up and hold each other accountable. And reporting violations to that 8600 number. And then we have law enforcement officers in each jurisdiction who will be going out, or code enforcement officers going out and issuing tickets. The ticket is a fine for up to $5,000. And so we are hoping, we have increased the enforcement and promotion of that complaint line. We do follow up with every complaint that we get. That's really important for everyone to understand too. And sometimes the complaints come in via email too, the COVID questions and other avenues, direct emails to me or to our staff. And so just so you know, we do follow up with every complaint that we get, not just the ones to the 8600 number.
A lot on Neil's plate. This is around the school districts, and I think it's important to point out that they have been, please correct me if I'm not using the correct language, but that they've been deemed kind of an essential business, if you will. And so they are kind of autonomous and able to make their own decisions. But it kind of feels like they are loosening their restrictions regarding quarantine, with the high schoolers and stuff. Can you speak to that at all?
Yeah, so actually they're not loosening their restrictions. They're actually going to start following the current guidelines for school. And that actually follows more in alignment with what we do in typical contact tracing. We're really going to dial in and focus on those who are in close contact with each other. And instead of quarantining an entire cohort, for example, the cohorts are set up based on the number of staff that are interacting with kids. And so some of our cohorts might be pretty large, might be 60 to 100 kids. And so, for example, one child might be positive in one class, but might not interact with anybody in any other class. The only thing they share is a teacher who's maintaining distance, masking, etc. And so it doesn't make sense that we quarantine classroom B when they don't interact at all with where that case or exposure has happened. And so this is a way to have less disruption for in-person learning, and it is the current guidance that's there for schools to follow. The other thing I would like to address is that, yes, Blair, you're correct. The school district has their own authority under statute, and they make their own decisions whether they close or not. They do have to follow, of course, the guidelines that are out there for them, but they decide whether they close or remain open or go remote. And they also follow what CHASA does. CHASA is the Colorado Sporting Association. And so they follow what CHASA does. So they also get to make their own decisions regarding their sports teams. We do not have authority to restrict that at this time. I know that there are conversations happening at the state level with CHASA to see, given our state numbers right now, what will be their path and the path they take. But currently right now, under CHASA, those sporting events can still occur. We can restrict how many people attend those events as far as spectators go, but we can't control whether they continue with those sports or not.
Thanks, Amy. Great segue. Let's talk a little bit about limitations on indoor recreation. That had come up Wednesday after I think you all had met with the state. And I guess the specific questions that we're seeing, can you speak to group sports or organized recreational youth and adult league sports? Does this include practices, or is it specific to competition where they are playing against other teams? Is there a goal to limit youth getting together at any age when it is organized, regardless of distancing and capacity guidelines? Happy to repeat some of those if I need to.
Yeah, definitely. I can help address some of that. So gyms in general, 25% capacity up to 25 people. Things get a little bit more complicated when you're trying to look at leagues and things of that nature. Currently, adult and youth leagues are prohibited from happening indoors at this moment. They can occur outdoors. But with practices and such, Amy, do you have any guidance on that?
I'd have to look at the detail, but I believe it's 10 or under that they have to maintain 10 or under for practices at this point. We can get back to you on that clarity on that one. Sorry. Don't have it in front of me right now.
So a few around short-term rentals. How does the public health order translate to short-term rentals? Can more than 6 people occupy a rental property?
So two kind of big changes that have happened to short-term rentals since the last public health order, and this went into effect on the 23rd, so second to last public health order. First one is that short-term rentals are allowed to have a maximum of 10 people in that house, made up of no more than 2 households. And that's regardless of whatever their short-term rental permit states that they're allowed to have in there. The public health order limitation is what needs to be followed there. And in addition, the other thing that was added for short-term rentals is the need to verify and confirm the identity and group size of who is staying at that short-term rental. So those were some new additions made there as well.
And Hannah, we've been getting a lot of questions at the county level with what do we do if we already have booked our short-term rental for a larger group? How do we address that?
Yeah, that's a challenging one. We know people have made reservations for holidays, are wishing to come out here for Thanksgiving and have large houses that they've rented. But unfortunately, these reservations are not grandfathered in. So they need to adhere to the current regulations at the moment on group size.
All right, thank you for clarifying that.
Back to a little bit of capacity questions around restaurants. If there are 2 rooms, if a restaurant has 2 rooms, is it limited to 25% per room, or is the whole establishment limited to 25% no matter the number of rooms?
Yeah, so it would be 25% per room. And a room is really a separated space. So that can be a doorway that separates that, separate levels, things of that nature that are really separating those 2 spaces.
Great. Let's see. Let's move to a construction industry question. Being that we are a construction firm, should we limit or not allow our team's interaction with homeowners during remodels in our client's home?
I mean, I think doing everything in your power to limit, those risky situations. I think in that case, you'd want to still follow that guidance for indoor gatherings. So if they're meeting indoor at a home, not exceeding the 6 people made up of no more than 2 households. Maybe that's the contractor and, the couple that are having their home remodeled or something of that nature. But still following those guidelines would be important.
Great. Can you guys speak a little bit to transportation restrictions? I think that both at the summit stage level, but then what will that look like for ski resorts when you're moving, from a parking area to a base area?
So they, and this is in all of the winter operation plans for all of the ski resorts, they have to follow the transportation guidance that we have in our order as well as the state guidance. So they are not accept an exemption from that at all.
Great. And will that change with the new order? Does that bring capacity for all buses from 50% down to that 25?
No, buses are still at 50% under our order.
Thank you. What is the messaging around personal health practices to strengthen immunity, such as supplementation? Is the community being asked to rely only on the 6 basic practices to bring numbers down?
So we're focusing on what the best data and research shows us, and that is what we know. I think it's really critical to understand, again, the unintended consequences of having such social isolation for so long, and having to follow, what for some feels really overstepping into personal liberties. We hear that a lot, and we know that these are the things and the tools that we have to fight this and suppress this virus until we have a vaccine and better treatment or a cure. This is what we need to do, and the light is coming. We are going to be starting to get vaccine likely sometime in December, late December, early January, where we're going to be able to start vaccinating our top tier groups of the batches that we get are going to be pretty small. And so we're going to be really focusing on, our healthcare workers, et cetera. And then hopefully as we get more vaccine in, or as we do get more vaccine, we'll continue to expand the population of who we're able to vaccinate. But the other things that are really critical for everyone to do is to continue to connect with people as much as possible in the ways that we have. And we're so fortunate now that we do have technology and we have other avenues of connecting with people. You can still check in with people, just do it safely, wear your mask, keep your distance, make sure that you're, complying with what we know works to say, to take care of yourself. We have amazing resources here for behavioral health support. So if you're feeling that that you're needing more professional support, please reach out to Building Hope and FERC for other resources that are available in our community. We have amazing nonprofits here in our community who can also help in all sorts of other ways to keep us healthy, both inside and out.
Great. Can you speak a little bit about capacity for hotels in comparison to short-term rentals? Do hotels have to operate at 25% capacity?
So in terms of what we talked about with short-term rentals, it all applies to what's quote short-term lodging, and hotels does fall under that requirement. So they would be following that guidance.
And I guess,
Okay, cool.
Related to that, it looks like there's a few questions in the chat about, if you have, why does a short-term rental or a short-term lodging be able to have 10 people in it while, a homeowner may only be able to have 6 people come visit? What is the difference? What is the, idea behind that?
This is a really good question and a difficult one. We know that short-term rentals actually under the state public health order, we're supposed to be following that 10-person max anyway. We know from complaints that we've been getting for the last several months that hasn't been happening. So we clarified that in our own order to make sure that we are restricting them. This is a huge change for them. And so we were going to start with that. And if we continue to see violations with that, we will amend the order to be in accordance with that 6-person gathering.
Thank you. Trying to make sure I get to everything. There's a lot in here. You guys are great. Once someone is exposed and you're notified, let's say you get a test and quarantine while you wait. If test is negative, you are still supposed to stay at home for the full 14 days, correct? I've heard younger people are interpreting have to finish the quarantine.
Right, so that's a great question. And yes, if you have had a known exposure and you've been placed in quarantine, even if you get a negative test, you still do need to follow that quarantine. And for folks who aren't understanding that clearly, I hope that you are, and we can, I can certainly follow up with our contact tracing team to make sure that we're making that very clear. It's in the information that we provide to people in written form and certainly verbal form when we're doing the contact tracing and education. But it's good to know that there is some misunderstanding about that. So we'll make sure that we are making that more clear. So thank you for that.
Great. Just a couple of more questions around hotels. Do hotels need to limit to 25% of total hotel capacity?
I would say that that's not the case, that they should be limiting the group sizes, staying within those rooms.
That was the other question. How does a hotel manage only 10 people in a huge facility? Is it per room?
Yeah, per unit.
So they could book all of the rooms, but they just have to watch the numbers within and in those public or common areas.
Yeah, and that would include the household requirement as well within hotels.
Okay.
I think this is a good question. And if we're trying to get this under control, why are we still allowing short-term rentals? Sounds like that might not be the culprit in our community.
Right. And so with our short-term rentals, we really wanted to narrow the capacity of what we were seeing. You know, we were definitely seeing over the summer large groups, very large groups at short-term rentals, even beyond what the allowed capacity was. And so we really wanted to make sure that we're dialing that back in. We do have our ski resorts are opening. We want to make sure and honor that we can have a safe community. And so short-term rentals wasn't something that we were going to shut down at this point. We did do that in spring. We were one of the only counties actually in the state that ended up doing so. But again, I think it's really important to understand that this virus is here in our own community. We've been living with it since March. And so it's really up to us and our visitors coming in who, you know, we have great relationships with our lodging community. We've talked a lot about sharing information with them, how to make them aware of what our public health order is and make sure that they're, you know, asking them to follow what we have in place. I do think it's also important to understand that we have our own residents who are traveling outside of the county and coming back in. And so I think, you know, it's not just our visitors that are spreading this virus. It's really happening among ourselves and our own residents. We know that for the most part, and we've seen this over the summer, that you know, we did not have a huge impact on our residential cases. Despite the huge influx of visitors that we had, really a banner year as far as number of visitors go. We know that with the concerns about COVID, people weren't doing their typical vacations. So we did see more and more people coming to Summit County, and many businesses, you know, it was a good summer for them, not for all, but I think for a lot it was. And again, we did not see a rise in our residential cases based on that influx of visitors. So no, we're not as concerned about that as much as our own personal behavior and choices that our community needs to continue to follow.
Great. And along those lines, how are the numbers calculated? Are the numbers reflecting both locals and our visitors?
So we haven't seen the data lately from Centura. They're the ones that kind of present the data on some of our town halls regarding visitors versus residents. And I haven't seen that data lately. So that's something we could certainly present at our next town hall. You know, I'd like to continue to do these on a regular basis so we can have an opportunity to answer questions as we move forward. And so I'll make a note that we can present that at our next meeting.
That sounds great, Amy. But just to clarify, the numbers that are being reported at the state level on that COVID dial that you showed us at the top,
yes,
those are just our residents, correct?
Just our residents. So our case count, sorry, Blair, our case count is, I'm reading also other questions, so I'm assuming it's because of visitors, but correct. Our case count is only for our residents, those that have Summit County as their main address, and this is collected at the time somebody is getting tested. So it's basically linked to, for the most part, where your insurance is linked to. So whatever mailing address you're using, that is how it's getting counted at the state. And then statewide, that's how they count all the counties. It depends on where people reside. But that being said, I just want to make sure that people understand that our contact tracing team still also engages with you know, with all of our visitors and folks who may live in neighboring counties but work and are employed here in Summit County. We do investigations on anybody who has, that we know about, connection with either work here, or if they've come here to go to an event or come for vacation or whatever. If we know about them, we are interacting with them and making sure that we're identifying those close contacts, especially those that might be our own residents. I do want to talk about travel for a second, because there was a question. I'm not recommending that people don't go travel. I'm just saying that the virus is everywhere. It doesn't matter whether we have people coming in and out of the county, whether that's residents or visitors. What's most important is that everybody, whether you travel or not, do the simple things that we're asking you to do, which is to keep yourself safe and your family, wear a mask, physical distance, stay away from gatherings. This applies whether you're in Summit County or other counties, even if those counties don't have public health orders in place. Those are things that are going to keep you and your family safe wherever you may go.
Great, thank you. What if you're split parents and you have parenting time with your children from a technically different household, and they bring the number of people in your house to 8 or more?
Yeah, so I'm a split family. I'm divorced, and I share parenting time with my children's father, and so I'm in that situation myself. But certainly, it doesn't. If your own household puts you up over the limit, of course that's an exemption to the public health order, and you're already kind of all one household because the kids are going back and forth on a regular basis. So that's just an exemption, and it's a great question, but absolutely that's something that we talk about. But what that means is that you wouldn't necessarily have another household in addition to that join you if you're already up above that number of 6.
Great, great. Let's finish with a question about second homeowners. What about second homeowners in the holidays? What communications are going out? They may not be here now, regarding gatherings from various states coming together here. So I think multiple groups of people from out of state congregating in here in Colorado.
Right. So I know statewide, and through all of the meetings we've had statewide with the ski resorts and other hospitality groups, they're really trying to focus on messaging, to be smart when you're traveling here to Colorado. Make sure that you understand if you do come, you might be asked to stay for 14 days if you've been identified as a close contact, or isolate, if you have COVID. So you have to be prepared that might extend your stay if you do come to our community and our state. So there's statewide level messaging happening. And then of course, through all of our short-term rentals, lodging, industry partners, that messaging is coming out as people make the reservations. It's on websites, it's in the rooms. Our towns are doing a lot of messaging and partnering with us as well. So we're hoping we're getting the messaging out, but it's not a perfect situation. We're not going to reach everybody. We're doing Facebook Live events every Friday at 3 from public health staff. So we're giving people the updated information of the week, the hot topics that people need to understand and know about that's going on. We're doing Facebook Live town halls for our Latinx community. That's been ongoing as well. And then we have our public health meetings, board meetings they're public and open to anybody. Those are twice a week happening. And then we're continuing to do our engagement with town halls, with you all, with our restaurant association. So we're really trying to do a broad way of getting our communication out and partnering, of course, with our local jurisdictions to do that as well.
Great, great. We do have some questions that we weren't able to get to, and we will try to wrap those up. But Hannah did also put the contact information for any COVID questions into this chat. It is COVID questions at summitcountyco.gov, or you can call 970-668-9730. I do want to really encourage everyone on this call. There is an updated economic impact survey out. It will be open through Thursday, November 12th. I cannot stress how important it is for us to collect this data, and your help is just critical in us being able to understand the trends that are taking place as a result of this pandemic. I want to, thank all of our viewers. We really appreciate you getting on this call and participating in such short notice. I really want to thank Amy and her entire team. And I think that Void really captured it best here in the chat. Amy, between COVID and election results, are you getting any sleep? I hope so, and thank you so much for your work. And I think that we all echo that to you, Hannah, your entire team. You guys do a fantastic job, and we just are so grateful for your work. So thank you.
Thank you. We appreciate that. And we appreciate all of you sticking with us in this challenging time.
Yes, thank you. Thank you, Blair and April, for throwing this together, and Nicole, you too. We know that this information came out quickly, and we're sorry for that rapid way of communicating, but hopefully this gave you an opportunity to have some of your questions asked, and we're certainly open and willing to do this again as soon as you would like us to. So thank you, and again, sorry for meeting with you under these circumstances.
All right. Well, thanks again, everybody, for chiming in here. Our team, as you know, did their best in terms of answering all of your questions. Again, if you still have questions or we weren't able to get to yours, please feel free to reach out to the email or the phone number that were provided here. And hopefully we start seeing things swing the other way for us. Take care, everyone.
Thank you.
Thanks, guys. Happy Friday.
Happy Friday.